Hello, everyone. Welcome to our webinar. Here, we're going to provide an introduction to physical therapy for people suffering with chronic pain. My name is Dr. Chad Schafer, and I'm one of the clinical leaders here at Override. I specialize in helping chronic pain patients rebuild movement and confidence and overall reduce pain.
Hello. I'm Kris Sutton. I am a pain coach here at Override, and my work focuses on pain neuroscience, mindfulness, and helping people rebuild confidence in activity step by step. Today, we're going to talk honestly about why traditional PT often falls short for chronic pain patients. We're going to also look at different, more holistic approaches that PT can look like. So before we talk about what physical therapy should look like for chronic pain, let's really start with the reality. What would you say are some of the big concerns that people bring into PT in the first place?
I think it highlights, like the question itself highlights why people are seeking some sort of service, right? So physical therapy is but just one option out there that we can seek as individuals, right? But I think the obvious answer tends to be pain. Right. Some individuals as clinicians might see patients for sports performance or, physical function if you're at home, but primarily it's for some sort of pain related complaints. You could be back pain, neck pain, kind of you name it. But I think really on a deeper level outside of pain, people are looking for the answers to their questions. Right. So especially nowadays when it's kind of hard to find really good information about what's going to help an individual help resolve their problem and kind of move on with their life. And so what I've noticed over the years of treating patients as a clinician is, and we'll talk about this in a little bit, is just fear, right? Where any clinician that's watching this is going to be like, oh yeah, I see that a lot. And as we explain the fear part of this, probably a lot of individuals are going to say, oh yeah, I recognize that in myself. So I think fear is a big underlying factor that people are coming and seeking services, in this case, physical therapy, right? To see, do I need to be scared of my pain, right? What is this getting in the way of? Are there things that I haven't even noticed that I've pulled back from in my life? Could be an exercise or a movement, but again, more meaningfully, it's usually, am I doing less at home? And am I being less socially engaged because I'm scared of, say, my back pain or whatever that might be? So fear is a big one. Kind of tied within that, I think, is the idea of permanence. And I think a lot of people resonate with this, where especially as we all age, right, things sometimes kind of hurt, right? But I think it's important for individuals to kind of go through a process and know, like, hey, can they change their symptoms? Can they get stronger? Can they feel better in their body? And I think what I've noticed over time, and what many clinicians would probably agree with me, is that idea of permanence doesn't have to be there. Mm-hmm. And I think just people are kind of sold let's just say like a bad bag of goods, where it's like, you have this, for example, you've got a bad disc, and I forever have a bad spine. So I have to limit my life I kind of build my life around my issue with my back or maybe my neck. So permanence is another big thing, is can we as a clinician and the relationship with the patient, can we move past those things? Can we learn to understand, just as individuals, that we have some control over that? I think that's that last piece that I'll kind of tie into the pain question, is what we call self-efficacy. And Kris, I know you know exactly what this is. And it's just really our own ability as individuals to know, do my actions and can my actions shift my situation? So you could use this in any scenario, right? But when it comes to health, and if we're having a good conversation about pain, it's understanding, patients want to know, people want to know, is there something I could do, like on a simple level, right? So I think all those things tie back into that original question, is, why are people, what are people seeking when it comes to PT itself? I think there's a lot of components that go into that pain word.
Yes, and that fear of movement and thinking, oh, this is forever.
Yeah.
And then helping people find, hey, actually, you have self-efficacy. You and move the needle on these things, and helping to empower people is really what is possible. I see this all the time, and that, I think, is the power of what you do, and what I do as a coach, and what we do together. And so, what would you say, working virtually, I hear that sometimes. I'm sure people are like, wait a minute, you're working virtually. How do you do PT virtually? How does that even work?
Can't be a thing.
Yeah. How do you do that?
Yeah, great question. Probably the first question that anybody has, whether you're a referring provider or whether you're a patient, is, I mean, heck, the word physical is in it, so you gotta be hands-on somehow, right?
Right.
And I think that's a really good question, because I think it can be polarizing for some people, meaning that a lot of times people can get stuck in this, like it's only this or it's only that, right? Where I traditionally, the field of PT is hands-on, in person, movement based, right? But there's a lot of things that we can do virtually, and I think it sometimes has an advantage over some of the traditional in-person delivery models. And I think there's always going to be a place for having healing touch, right? Being able to put your hands on something. We know that creates real nervous system changes, physiological changes. But I think what's really unique about the virtual piece is, when someone presents with any given condition and they're going to hop on a video session, they already know that you can't put their hands on them, right? So it opens up a really kind of unique space that we can start to have deeper conversation in PT, right? Where I think, a lot of individuals think that PTs just do muscles and joint things, right? And having the virtual setting allows us to be in a space where it's like, oh, we're going to have some really interesting conversations. We're going to talk about a lot more than I thought we were going to talk about. So not just what are your goals with walking or standing or lifting your arms overhead, but what do you think about your pain? Do you think you can change it, like we mentioned just now? And the virtual setting really opens up that unique opportunity. And I think when I've seen patients over time, especially in the virtual setting, especially what we do here at Override, is I tend to kind of think of people in two different buckets. One bucket is an individual that has a pretty, what we would consider like a clear-cut mechanical presentation, meaning maybe you've got back pain and maybe leg pain, sciatica, right? That's the common term for that. And then you have this whole host of people in this bucket that have maybe been mismanaged, and not really with intention from a clinician or medical providers, but they've been mismanaged through too many visits, too much exercise, too little exercise, whatever it might be. So that bucket of people I get really excited about, because it's like, well, we've seen these things before and they're very common, right? And sometimes they're even textbook. So it's great because when we have that virtual setting, yeah, sure, you can't put the hands on somebody, but you have enough time to really understand the condition, really understand what's making it better, worse, and then identify the pattern and hopefully fix the pattern, and then they can kind of move on with their life, right? They can get that sense of permanence and kind of erase that and get their life back. And I think the other bucket of those people, right? And it's not really mutually exclusive. It's not like only this or only this, is the people that have this more chronic pain presentation, where maybe they have more widespread pain. Maybe they have comorbidities, diabetes, history of heart disease, plus they have some psychological concerns that we're working on. And those individuals are also very exciting to work with, because they've also been mismanaged, right? They've just seen the PT, or they've just seen a coach, or they've just seen a car, whatever that might be, right? So virtual setting gives us a chance to really work with both of those individuals, but it also allows a person to kind of identify where we call drivers of disability are. So what I mean by that is kind of what I just mentioned, right? If we've got a person in front of us, if you're watching this, maybe this is you, right? And drivers of disability for us as clinician means, is this coming from the nervous system? Is this just muscle and joints? Is this tied in with anxiety and depression? And so it's the answer, as I'm sure, Kris, you know, right? It's oftentimes it's all those things.
Yeah. Yeah. We have a nervous system, and it's all connected to everything. And so often that's not looked at, and it hasn't been considered. And that's, with this kind of integrative model that we have, it gets looked at from everyone. But
have you heard anything from, your experience as far as that objection to, like, how could you do physical therapy over a video call?
Oh, yeah. Well, and, I'll hear people say, well, I've been through PT before. So, no thanks. I already did it. Or, I don't want to do it because when I do it, it makes it worse. So, there is that fear avoidance. So what do you say to that, to people who, are like, I don't want to do it. It makes me worse. It makes it hurt worse.
Yeah.
How do you approach that when people have that fear, and the fear it's going to make it worse?
Yeah, I think that's probably the number one thing that individuals bring up. That's honestly one of my favorite questions to ask people. And usually they will be pretty forthcoming of, like, I've already done this before, and they're kind of, they don't expect much from the situation. But from our perspective as physical therapists, and maybe even for coaching, if you're asking similar questions, is it gives me an understanding of, one, the type of care they received in the past, and is it adequate for their current presentation? But also gives me a little sneak peek into their kind of biases, right? What they actually think about it, right? If they think, a PT, for example, is laying on a bed for an hour with a hot pack and maybe some electrical stimulation, like, that ain't it. that is not where our field is now and where it's heading. I think that can have a place, right? I stole this from somewhere, I don't know where, somewhere on social media, but I commonly see it in our field as the PT didn't work starter pack, where it's like the easiest exercise. It's going to be something like a modality, like electrical stimulation. Again, nothing wrong with that, but we have to use it as a tool at the right time. And so, kind of back to your question, right? Us understanding as physical therapists what you've done, what your biases might be, or what they think physical therapy might be. We have to really understand that, so then we can kind of break that down and say, okay, that sounds like you've had some experiences, and maybe it was helpful, maybe it wasn't helpful, but then also gives us the opportunity to say, here's what we do here at Override. Here's how it's different. And so we mentioned that term earlier, drivers of pain. We want to open the conversation about all things that are going to have a potential impact on someone's suffering or lack of range of motion or strength, or really just function, right? The other one is the flare-up piece.
That kind of goes with the fear that
sure.
People say, well, I tried the exercises. I've heard people say, well, PT, that stands for pain and torture.
That's rough.
Yes, not from Override.
Yeah, of course.
When I went to PT years ago myself, and they're, oh yeah, it stands for pain and torture. But which has not been my personal experience. PT has always been incredibly helpful for me. But people it goes with the fear of trying it, because people have found, in their past when they've done it, like, oh, it flares me up. And, and sometimes that can be a piece of it, but like, how do you adapt for that? How do you address that when people have that concern?
I think it hits home for most individuals, especially if they've had an experience where it does flare them up, right? I'll give you a quick patient example because I think it kind of highlights this. This is a recent patient of mine, complex medical history, kind of complex presentation. And she had a first session with an in-person physical therapist. Again, nothing wrong with that. I also do that. That's how we're traditionally kind of built, right? But just to kind of hash it out, whether it is in-person or virtual, but in this patient's case, it was a traditional in-person visit. And she got so flared up probably the most intense I've ever seen, where, right away she's messaging me I think I'm flared up. It's 10 out of 10. This poor lady slept an hour a night for a couple of nights. We ended up having to cut our session short because she started to get sick. She had so much discomfort from that soreness. And I don't think she's alone, maybe that might be an extreme example, right? But people will have that experience and they're like, no way I'm going back. And then we're wondering on our side, how come patients aren't showing up to our sessions? This doesn't make any sense.
Right.
So I think one of the biggest things, at least that all of us do here, is we really want to connect with that individual and have an open line of communication, right? We try to do this in this first session and say, we're really open to feedback. We want to know how you did and kind of what you're scared of, right? So that way, if you come back the next session and we ask you, hey, how'd you do? Like, be honest with us, because there's this kind of innate feeling that people have that they want to please their providers a lot of times. So they might not tell the truth, right? Which is, I think, sometimes normal human behavior. But we really want to understand this so that we can change things if needed. But also, we want to talk about pacing.
I think what's kind of nice, it's very nice about the override model is, and we haven't really talked about this piece, but our patients at Override, they have access to getting PT, pain coaching, behavioral health, and a medical provider. And they can use as much of that of our team or as little of our team as they want.
Yeah.
And so they're getting pacing as a tool from all of our providers. And so we're all reinforcing this tool of pacing. So I'll talk about pacing as a coach, and you talk about pacing as a PT. So pacing, I'll give a story.
Good.
One of our providers, actually, one of our coaches, she used to have incredible back pain. And it was determined when she was in her recovery that at one point she had about 45 minutes that she could do. And so when she would go to the store, the clock was ticking, and they would put her in the car, lay her flat, and go to the store. And that included the car ride, that 45 minutes.
Okay.
And it was like the drive, 20 minutes in the store, and then the drive home.
Very specific.
Yeah, that was her pacing. So I would love to hear from you from a PT perspective, how you use pacing.
Yeah, probably very similar to you, Kris. I think, as we probably all have that same conversation with pacing, it could be in the realm of the simple physical activities. But I think it's also good to have that open conversation about the other pieces, right? It's like your pacing might look different based on how you slept, how much stress and worry you have, all those other factors that come into place. That way that person can feel free to kind of adapt that pacing and kind of take a little bit of that maybe shame, like them feel like being hard on themselves. Like, I can't do that 45 minutes or whatever that is that I worked with Kris and she told me this is the plan, right? But when it comes to the actual, we've got two pieces, I think, on our end. You've got within session and then real life, right? Within session, it's because we have this virtual setup, we have lots of things that we can do, right? We can dive into fear and avoidance and talk about mindsets and goals. We can do some guided deep breathing, which you and I both know is really great for nervous system resetting. For most people, that means less discomfort, less muscle guarding. And then we can also, of course, do exercises. But exercises can be very simple, and they can be more challenging. And there's really no equipment needed virtually, which is great. It's always a bonus if you have some of that, but it's not required. So pacing can occur when you're in the session from a clinical side of knowing that, hey, I'm going to go very conservative with this person because I want to establish that trust and connection And I want to have it be like the proof is in the pudding, right? They wake up the next day and they're not like, oh man, I can't stand up from the bed. That's not what you want. And then outside the session, same thing, right? If they, what you mentioned with your example of going to the store, I would have the exact same conversation with them of like, maybe even you warm up the body a little bit if you're going to go to the grocery store. Like, let's just start there, because I think individuals, and myself included, right? Like, we have a really hard time like zooming out from ourselves and seeing all those other pieces that kind of go into that. So I think it's helpful just to have somebody to kind of, hey, walk me through your day. Like, what's going on there?
Yeah. Yeah. So being able to kind of say, hey, you know what? I tend to get exhausted, or my pain flares up at 30 minutes. It's like, well, take a break at 20.
Yeah.
And when you've got chronic pain, you tend to be like, well, I need to keep pushing. I need to keep pushing. And then like, why is my pain getting worse and worse and worse? Like, well, I think we know. So when we can, take that break, and it sounds like with PT, you guys are very adaptable. You're listening to your clients. You're not like, drop and give me 20,
all the time.
You're very much adapting and listening to the client and saying, let's pace this to what's working for you. And then we'll adapt, and then we'll increase when the timing is right. Yeah. So paying attention to the fear, training the brain and the nervous system and the body to adapt accordingly.
Yeah. I think one last thing, sorry to interrupt you.
Sure,
One last thing that I find is valuable just from feedback from patients, and that experience is asking them what they deem as acceptable. Like, let's just say muscle soreness, right? Say you're starting off some PT. We'll commonly talk with people about that and say, what's an acceptable level of, if you do have some muscle soreness? Like, it's subjective, right? But is it a 3 out of 10? Are you okay with an 8 out of 10? Right. That also gives us like a level setting of like, the person gets the control, right?
Yes.
I think traditionally in the medical model, it's like the clinician is in charge and we're doing all stuff, right? We know that doesn't really work. The shared decision making between ourselves and the patient is huge. They can tell us as the therapist, like, this is what I'm willing to go on the journey with you with.
Yeah, and it has to be the client in charge. The patient has to have the autonomy. Otherwise, you're just going to be like, see ya, bye. We are here to serve them rather than the other way around.
Absolutely.
I'm curious, how you really connect with our interdisciplinary approach. What do you find works best for you, and how are you using the team to help our patients most effectively?
Yeah, absolutely. And so to zoom out a little bit, the interdisciplinary approach means we've got PT, coaching, pain, medicine, and psychology, right? Did I miss anybody there?
No, I think that's it. Cool. That's the team.
Right. I think as much as I'd love to say that I know everything, and I feel like I'm constantly learning from different people and courses and things like that, we don't know everything. Right. So I think there's always a time and a place when you're saying, I think I'm at the edge of my limit of kind of where I'm at. Like, let's use anxiety, for example. Like, there may be things that I can help the patient open up about. We can use some breathing, we can do some techniques, but I'm not medically treating anxiety like maybe a psychologist would. Right. So for me and for us as physical therapists, it's nice to have highly trained individuals that have this experience with chronic pain, these complex cases, and that you could literally just shoot a message on the app. I commonly will do that. Like, hey, I've got a little over my head. Can you help me out? Let's get you connected with this individual. And using our chat function more from a provider and giving you guys kind of like a little sneak behind the scenes is we're talking all the time, which is great. Where even something, it could be clinical or it could be something like, I've had a patient have a loved one go to the hospital, and just being able to send a supportive message like, hey, I heard this. Let me know how I can help. How can I support you? So I think that interdisciplinary model is really great because throughout someone's care, you can get all the pieces of the pie. That term that I used earlier, drivers of pain or drivers of disability and pain, we can address all those things, of course, in PT, but also right away we can get multiple individuals involved. And I feel like sometimes my role, if I'm identifying some of those things that are a little beyond my scope, is kind of what we call it, like outside of my realm of what I can do, is I'm kind of slowly working with the patient. We're working on a relationship and trust. So then when I kind of find an opportunity to say, hey, have you ever talked with someone about this? You know, so I think that's a great way to just kind of plug all those pieces together for the patient or a person's benefit.
Yeah, I love what I love so much about this approach is a person isn't just a back or a leg. It's a whole person approach.
Yeah. No way.
And the drivers of pain are not just the leg or the back. It's the nervous system. It's the brain. We're more than just tissues. We're more than just muscles and joints. We are a whole person. And the neuroscience really supports that. I mean, all of the research they're doing about pain is like, hey, it's the nervous system, and your nervous system is attached to your brain.
Yeah. All the moving pieces, right?
Yeah. And that's why we have the whole person approach, right? That's why, you have a coach, you have a behavioral health person, because you need a whole person approach. I know for the longest time when I was dealing with, all sorts of chronic pain, it was like, maybe this will be everything, and maybe this will be everything. It'll solve the whole thing. And it's like, it's a puzzle. And we've got multiple pieces of the puzzle here.
I remember seeing a graph. I'm a bit of a nerd, so I read research articles. It was like the analogy that I use for that nowadays is like people and patients, if they onboarded with medical providers, right? Their conditions like a dartboard. And then so our jobs as clinicians, like, can we identify and throw the dart as accurate as we can? The throwing is the intervention, right? The treatment, right? Can I get as specific as possible? And where do I go with that, right? Because it might be right in the middle. It could be muscles and joints, or it could be muscles and joints plus behaviors plus preconceived notions. So it's a nice kind of thought process around that, and helps. And I share that with patients too, and they're like, oh yeah, it makes more sense when you kind of use the example outside of just what you're talking about.
Right. Well, with chronic pain, people with chronic pain, how is PT different, and how is it different at Override? I mean, we've talked a lot about that, but I mean, what would you like to add to that?
The big picture pieces are, we're looking at the whole person, right? We're looking at the whole drivers of care. I think a lot of medical providers try real hard to get the whole picture. But whether it's time or complexity of a patient, it's just really hard to get everything. So I think one of the big benefits is we have the appropriate time. I mean, it's the only non-renewable resource that we all have. And so I even really appreciate, just as a clinician, is like, I've got all this time, I can get so much valuable information from this person that's dealing with complex or chronic pain. And we can start making a plan for what's appropriate for that individual. And the other piece of that is the individuals that we have that are employed by Override, right? It sounds like a really shameless plug, but I'm a pretty straightforward person. And I'll tell you my own experiences. We only hire individuals that are passionate about this and that have experience working specifically with chronic pain patients. So I know I'll tell you again, honestly, early in my career when I didn't know any better, it was tough. You get somebody that says chronic migraines in your schedule or chronic lower back pain. You just like, it's going to be really hard. I don't really know what I'm doing. But now it's like, it's kind of a cool puzzle, right? It's like, man, there are lots of things going on, and they're giving me this time, and we're going to form this relationship, and we're going to see, what things are affecting this. So I think that's a really unique model when it comes to addressing somebody with a complex condition.
One of the things too that Override has that I think is really valuable is the education that we share with the clients. How use it? We have an app that I use a lot as a coach. How do you use it as a PT?
Yeah, I mean, two big pieces. We kind of already talked about the chat function, but I'll highlight that too, just because it's simple. I think a lot of systems have it, but ours, I really enjoy it because we can it's literally just an app on my phone as well as a clinician or a web browser, right? I can message any other providers that I might need help with as quick as possible, right? But I can also message the patient. So again, following up, helping to reduce flare-ups, sending home exercise programs, videos, whatever that might be. And honestly, all that stuff is good that I just mentioned, but it's just the connection, right? If someone knows that there's someone on your side and you can just simply chat and message them anytime, that we know helps a lot. So I think the chat function is really nice, but the education piece is also really great. When I first joined this organization, I can't even remember the year it was, but I was fortunate enough to get the opportunity to write some of the education pieces because I think they're so important. So we've got all sorts of different topics, but I'll just highlight two real quickly. One of them is about managing flare-ups, right? It helps you kind of identify, read through. There's some video content, and understand what your triggers might be, kind of understand the pathoanatomy associated with that and the nervous system specifically, as well as having some sort of recovery plan. So the app is a way to kind of focus your mind or the person's mind on, okay, what's happening and what do I do? And then also most of the educational pieces have a little journal prompt, which I'm sure, Kris, you're big on journaling and reflection, right? It gives people an opportunity to say, like, what am I doing? Let me write this down and let me type it in here. The flare-ups are the big piece. And the other one I'll highlight is sleep. I think sleep is something that's, as soon as I say it out loud, most people are like, oh yeah, of course, like sleep's important, right? It's just so critical. There's so many awesome things that happen in sleep and recovery. And if we're not getting adequate sleep, we know we're going to be hypersensitive, cranky, and we're going to hurt everywhere. So really diving into how we can optimize our sleep habits. And maybe it's just a little bit at a time, right? Change doesn't happen all at once. And again, same thing, it gives you a little journal prompt at the end to go through and say, what am I doing right now? Give me a chance to reflect on this.
Yeah, those are both so important. And the app is just such a great tool for our patients to be able to go in and learn tools to help them to manage their pain. It has the educational pieces. It also has guided meditations. So things to help with, again, the breathing exercises that you mentioned, guided ways to calm down, things to listen to help sleep.
Yeah.
So it's that whole person care like we've been talking about. Is there anything you want to say before we wrap up?
No, just the big message that there's hope for people, right? There's a way that you can change whatever you're dealing with. And just, I think as clinicians, we have a group of clinicians that are just interested, which sounds kind of plain, right? But being interested and being really passionate about what you do, I think creates a really good setting for people to heal. So I just want to take a moment and thank everybody for joining this webinar today. I hope you're kind of walking away with this with a little bigger, a little clearer picture of kind of what chronic pain treatment is. And potentially if you're dealing with anything and maybe you've tried different treatment approaches in the past, like how maybe this approach could help you. And again, that virtual piece, especially with the PT, it's just people get turned off by that pretty quickly. But I think the more we learn about chronic pain and the nervous system and all those types of things, virtual care gives that opportunity. Well, one of the biggest things that we forgot to mention is that we're not location dependent. That's really cool. I kind of grew up in a small town, literally like there's nobody around, no neighbors. You're not finding an interdisciplinary care center around the corner if you have chronic back pain. It's not happening. So for me, it's really cool to be able to reach people. I'm here in Michigan or it's in Texas or it's whatever. So regardless of where you're at, you don't have to take a huge trip and go somewhere and get care. You literally can do it from your cell phone or your computer.
Mm-hmm.
That's a really big piece of that.
I love that we can reach people, just about everywhere. And from the comfort of their own home. And so many people with chronic pain, it's hard for them to get out to their providers. It's a lot of appointments and driving all around town, or there aren't providers. And so,
Yeah.
like you said, that's really helpful. So I think from this webinar today, if there's one thing we want you to remember, it's that you're not failing PT. With the right approach, with the right pacing and support, you really can rebuild your confidence in your body and in your movement.
Love that. If you're interested in learning more, just curiosity about what we have to offer here at Override, we can really support your journey, what you're going through, and help us really create a really strong team for you and what you're dealing with. And if you would like to kind of join us and again, go on this journey together, you can find us on all the typical platforms. We're on LinkedIn, Instagram, Facebook, or our website at override.health.
And be sure to keep out an eye for our upcoming sessions. We're going to go deeper into topics like fear avoidance, which we mentioned earlier. We're also going to look at the role of pain psychology. So on behalf of all of us, thank you so much for being here, and we're going to see you next time.
Thanks, everyone.